children have been in long-term care. So they have had mental health impacts.
From an Australian context point of view, what are the trends you are seeing in terms of within Australian demographics? If you can lay in a bit of understanding for young Australians, for Australians with disabilities, elderly Australians, and then young people, what are the trends in terms of health and healthcare you are witnessing?
So when you look at Australia's healthcare as a whole, it's one of the best in the world. We do have a fully functioning health system. We have the Medicare, and because of Medicare, you can go into a hospital and be treated. If you have an accident, you will get trauma care, you'll have surgery. If you are a cancer patient, you'll get cancer care. So all that does happen. But Medicare is not actually free because you pay 2% of your wage at all levels. So there is a Medicare levy that is given. And at the same time, there are gap payments that have gone on. Yes, there are very few GPs now who bulk bill. In most cases, you have to pay a gap payment. Now, I have done multiple studies recently, and that's why I can actually talk to you with that. So one was this Ukrainian one with refugee populations. So when it comes to refugee trauma, I get constantly asked, we need psychologists who are trained in trauma, war trauma or protracted trauma, to deal with our refugee populations. That's a need. But we have a shortage of psychologists across the board. So that becomes a challenge. So that's one genuine challenge that is there, that when refugees come in, they have the trauma, mental health trauma that comes from living in a war situation, that comes with displacement, but there could also be injury. Many a times in war-torn societies, men get beaten. They get beaten. So they might have fractures that have not healed medically. So that leads to pain. And so management of pain also is needed, and an understanding of that is needed. And I've had many, when we have done studies with South Sudanese in Melbourne and all, talk about this aspect too. Then the other study that we have done is youth at risk. So to prevent youth from becoming criminals, they need strong role models and a strong system of support in adolescence. But you also have you have a large number of youth that are falling through the cracks. So basically you have youth in the foster care system. You have refugee young people. You have people from indigenous populations. Now, another thing that I wanted to share is from 2002, I also became a foster carer. So apart from my 2 children, I've looked after 5 other children. So basically these children have been in long-term care. So they have had mental health impacts. But they have been in my long-term care, and one thing that I shared and have always supported is the value of education, the uncontested value of education. And I have supported them even after they have turned 18 because I've had the capacity to do so. I can do so. I'm financially able to do so. Not many foster parents can do that. I was fostering while working full-time. So I take kids who are not babies, who are in school. They will definitely have mental health issues because of their backgrounds, but they don't have huge behavioral issues. But youth at risk there are different levels. So, children born to parents who have had alcohol during pregnancy have fetal alcohol syndrome disorder, and they'll always have developmental disorders throughout life. The second thing is children who have had high rates of violence, growing up in a violent household, carry that burden too. Then you have children in their teenage years, for some reason or the other, get addicted to substances. It could be alcohol, it could be drugs, and then they spiral into a psychosis. Then you have others, because of cultural issues and honor-based issues. There's forced marriage, there's arranged marriage, early marriage, and then there are issues of modern slavery with young populations.